when we meet patients that have lost a lot of teeth over the years or have had a lot of damage to their teeth, there can be a little bit of shame or hopeless feeling like, where do I even begin? Or this is just how it is. And I think we can instill a little confidence in patients to let them know that we can comfortably offer options like implants to permanently replace those teeth, and that this doesn't have to be their destiny, so to speak. Just because that happened, we can meet you where you're at and move forward, and we can offer solutions and go at your pace, I think, is the most important thing. So it doesn't all have to be tackled in one sitting or at once or in one financial commitment. We can prioritize and execute at a pace that's comfortable for you. Implants and dentures are much different. Dentures come in and out of your mouth. They are often very uncomfortable. They're probably one of the toughest things to adapt to as far as dental care goes. And so, but sometimes that's the best thing for the person's budget, and we'll figure it out. The advantage of implants is it's permanently fixed in the mouth, doesn't have to come in and out. You don't have to worry about it falling out at a dinner with friends or family. You don't have to worry about taking it out and putting it in a dish or something like that to overnight. So yeah, the implant is the closest thing that we have to permanently replacing a tooth that was lost. And it's become a very common procedure, very streamlined, very predictable. And so we really pride ourselves on our efficiency and comfort in otherwise probably overwhelming sounding procedure for somebody that has never had that, been through that process. It's actually not as crazy as people think. One of the biggest complaints people have with dentures is that it's harder to taste my food. I can't chew or tear food as easily. They fall out, or I have trouble with them staying in. And with implants, we don't have those issues. You don't have a big piece of plastic sitting over your palate. You can still taste everything. You don't feel like you're gagging on a denture. You don't feel like it's not going to come out or come loose. So you're pretty much chewing with 100% of the efficiency as you were with your original tooth, as compared to with a denture, which is about 20% of the chewing force. When we're looking at multiple missing teeth and trying to figure out if a denture or implants are going to be the best route, first we want to find out patient's goals. Okay. So some people are very financially motivated, but they don't realize that implants maybe aren't quite as expensive as they think. People come in with assumptions and, oh, I heard this on a commercial, or I read this on the internet, or my friend or my brother or cousin had something done. And it's like, all that's great and probably true. However, let's talk about your situation, because it might be a lot different. And let's start by exploring the best option, which is probably going to be an implant. And if that doesn't work, let's work our way back and figure out what's going to meet for your time, energy, how much you value your teeth and your oral health, because an implant's always going to be a better option than something that comes in and out like a denture. And the great news is it's just more and more affordable than people realize. One thing I tell patients a lot is that the implant procedure is actually way less uncomfortable than even an extraction, actually. So getting a tooth removed. And when I tell them that, they're like, "No, you're gonna be doing all this stuff. You're gonna be drilling into my bone," is what patients say to me. And I'm like, okay, well, that sounds pretty intense. When you put it that way, I agree with you. But in reality, the implant procedure is way more comfortable than a lot of other things in dentistry, and the technology is advancing all the time. There's so much money and research put into implant dentistry, and we're on top of all those latest trends. That even in my career of a little over 10 years, it's become a more efficient, predictable procedure with less steps and better materials. So if you come to our office and we're talking about replacing a missing tooth or multiple missing teeth, one of the first things we're going to do is to take a 3D X-ray, which shows us the health, the width, the height of your bone, and we're looking at these things in terms of millimeters, very, very precise. Okay, and we're gonna go ahead and start by looking at that. Then we're going to show you a short video to show you in very simple terms the multiple steps in the implant process and to demystify the process. I think there's too many things that we hear from friends, family, or people's experiences, and that may not be your reality. So let's just focus on your particular situation and educate you on that process and determine if an implant is the right treatment for you. Compared to a denture, which comes in and out of the mouth, is still actually, it's actually way more appointments than an implant procedure. And ultimately, it's something that you can lose, that will become looser over time, and is generally not something that people are excited about having in their mouth. So we always encourage people, if they can swing it, and depending on the case by case basis, having something permanently in your mouth like an implant. The cost of dental care is a big question and concern for patients, and rightfully so, right? And the thing is, we like to show people that prevention, or getting ahead of things, the earlier we get started on treating a tooth or an area of the mouth, the cheaper it's going to be in the long haul, actually. And so it's hard when you're making that initial investment sometimes to wrap your head around that. And people might think, oh, I'm just going to deal with it later. But dealing with it later ends up with greater expense, actually harder to restore and repair if a tooth's more broken down, and it just leads to other things, and then we're constantly playing catch up. So if somebody comes to our office and they have a handful of teeth that need dental work done, we try to prioritize in order: what's the worst tooth, then what's the next worst tooth, and just over time, if we chip away at things, we find people that follow that plan will get to a place where their mouth is stable. And then we want to get to that maintenance phase where we're just monitoring things. And when things come up, it's not like we're having to rebuild everything. We're just hopefully focusing on one or two areas. And we're in a much better place when we're in the maintenance phase. If somebody's concerned that an implant's going to be more expensive than dentures, for example, we like to remind them that we can break up the payments, because an implant procedure can be 6 to 9 months. So we can tackle the cost in bite-sized chunks, but also the price is probably a lot less than whatever the patient might have anchored themselves to. And dentures come at a cost too. So I know that cost is important to people. We lay everything out very, very clearly, and we try to make it manageable for everyone. When we're talking about maybe a single missing tooth and replacing that with a dental implant, yeah, you're going to get that tooth replaced, and it's going to be as close to uh, the original tooth as possible as far as shape, feel, chewing capacity. One thing that many people don't realize is leaving spaces or gaps in our teeth from missing teeth is that the adjacent teeth start to tip. If it's a lower tooth, the upper tooth will start to come down, and then it can eventually cause jaw problems and other issues. So having a complete dentition is really actually beneficial beyond just the appearance of it.